Good afternoon. Thank you for joining us on today's webinar. This is Anna Johnson with John Burden Advocates for Youth, and we are here today to talk about the Assembly Bill 2035, Healthy Futures for Foster Youth. As folks are dialing in, we're just going to take a moment here for people to get their handouts downloaded and their logistics up to date, and we'll be good to go. So we'll give 1 minute as folks are continuing to dial in. Good morning, everyone. As I mentioned, my name is Anna Johnson, and I'd just like to walk through some information before we begin our webinar that will help everyone participate fully. We do have our call-in information with an access code, and we would love for you to submit your questions through the panel by typing into your control panel any questions that you have. We do have question and answer session today where we'd love to answer any questions for you. We also have a handout section of the panel where you can get today's PowerPoint presentation, a bill fact sheet, as well as a sample letter of support if you'd like to support the bill itself that we're going to be talking about today. Those are all in your control panel. So please take a moment now to click and download those handouts and make sure you have everything ready to go. The other thing that I'll let you know is that we do have a training archive, which the website is listed here. And all of this presentation and the materials will be posted after today's webinar to that link. So you can go back and see this information after it's presented. So great. So we'll get officially started now. And again, welcome. Today we have a lot of information to cover. We're going to be sharing a little bit about our current reality and the disproportionate health outcomes that we're experiencing for our youth in foster care and out-of-home placement probation around their sexual and reproductive health. We're going to talk about the state and local needs in this area and review current law through SB 89, what's already in place. We'll then talk about a legislative proposal that builds upon our current law to enhance and ensure healthy futures for foster youth around their sexual and reproductive health care. And then we'll talk about how you can get involved in supporting our legislation in this legislative and budget cycle. And finally, we'll end with a question and answer session. And here at the bottom of the slide, you'll see all of the co-sponsors of this legislation that are working collaboratively to improve health outcomes for our youth. We do have some amazing panelists today. Assemblywoman Blanca Rubio is joining us, who represents Assembly District 48. And is the legislative champion on this proposal, AB 2035. And so we'll hear primarily about the need for this bill from them. And then we'll have our co-sponsors and some young folks, as well as educators who teach caregivers about sexual and reproductive health rights, information, and access, talk about our current training program and what could be bolstered about that program. And finally, we'll have folks talk about the law and what we're seeking to change. But we have an amazing set of panelists. All of these links here on this slide are active links to see more about their work and learn more about our speakers. So feel free to click on those, again, from the slide deck in the handout. So first, what I'd like to cover is just what has propelled all of these advocates to come together and advocate for this bill and propel for this legislation. So California is home to the largest child welfare population. We have a diverse population, and I'd like to just point out from the beginning that we serve youth of color and LGBTQ, lesbian, gay, bisexual, transgender, and queer youth at rates that are disproportionate to the general population. So we see more in foster care and in our system than would be represented in the general population. And I'd also like for folks to understand that we have around 800 current young parents ages 10 to 20 in out-of-home placement in our child welfare and probation systems. So this is just a little bit of background that I think can help. The other thing that I'd like to share to kick us off is that over the last few decades, California has built a pretty impressive network of sexual and reproductive health information and services that are intended to address the needs of adolescents. For example, we have mandatory comprehensive sexual health education in middle and high school, consent rights, access to care confidentially, trained clinics, public funding streams. We have training services for teens and for caregivers, and these are free. So we do have a lot that we can build upon. And as a result, this network of services and programs have been effective in reducing teenage pregnancy rates across the state. Even nationwide, we're at historic lows across the country, with California leading the charge, along with Massachusetts and Connecticut, with the largest percent reductions in pregnancy for teens overall, meaning unintended pregnancies that were not planned or were not part of that child's decision at the time. So what we do see, though, is that this downward trend in teen pregnancy rates is not yet reflected when we're looking at outcomes for youth and young adults in the foster care system. In fact, almost half of youth in foster care in California will have been pregnant at least once by age 19, and that rate is more than double the rate of people who are not in the foster care system, meaning females and female pregnancy. So again, like I mentioned, this is sort of counter to the national and state trend. And again, this next slide just shows the general youth population in blue and the California foster care rates of females who have ever reported having been pregnant. And we do see that sort of gap in rates. And so we're looking to ensure that youth have had the same access to services and care that the general population does receive. And just a little bit more that I'd like to share, just as adolescent parenthood is disproportionately impacting use of in foster care, and as I mentioned earlier, that is disproportionately impacting youth of color who are represented in our foster care system, since they do make up half of all youth in out-of-home care supervised by child welfare services. Actually, only 24% of youth under 18 in the general population. So this suggests that all else being equal, the foster care population will have higher birth rates than the population in general due to the extent disproportional representation. So here, what I'd like to say is that of youth in care that did get pregnant, 2/3 said that the pregnancy was not intended, which leads us to question what is sort of getting in the way of our policies and practices that have worked for the general population, but for young people in foster care. We want them to live in a healthy sort of sexual and reproductive reality that they see for themselves. And when someone does experience an unplanned pregnancy, that can set up some additional barriers for the youth as far as their educational attainment, their economic stability, and the potential for multi-generational involvement in the child welfare system. All of these things can be very costly, and so we want to make sure that young people are supported with the best information that's out there, with services and supports for family planning and contraceptive counseling, and that they have the same access as youth in the general population. All of the information is cited and sourced in the handout, so if you'd like to learn more about any of those numbers or statistics, feel free to download that from the handouts panel. One of the main reasons why we want to pay attention to our parenting youth population and to this issue is that we're actually seeing disproportionately poor health outcomes as far as prenatal outcomes. So compared to what we would like to see if a young person is having a child is pregnant, that they're receiving prenatal care, but about 1 in 5 of our youth in foster care have not received that prenatal care. That can really impact the health of the mother and the child during birth. And what we do see is higher rates of stillbirth or miscarriage among our young parents who are foster youth. And we see a lower rate of live birth and uncomplicated birth. So again, prenatal care can support healthier outcomes. And when we have 1 in 5 young people not receiving that, we want to call attention to that and see what we can do to improve the health of young people. Another disproportional outcome that we see is high rates of sexually transmitted infections among young people in care versus in the general population. So nearly twice that of the general population for young women and young men in foster care compared to not in foster care. There's a lot of good evidence and information out there for how to prevent and reduce sexually transmitted infections, and we want to make sure that our foster youth are able to receive those. And currently, we're seeing this disproportionate health outcome. So when we do see this big difference in health outcomes between different groups, it can be helpful to see what some of the systemic barriers are that exist that influence their access to sexual and reproductive health care and create health risks. So for youth in foster care, there are a number of issues that are unique to them that make it particularly difficult to access care and information. For instance, young people in foster care often experience changes in housing, school placements, and those changes can make it hard to access sexual health education in schools. They also may experience changes in their providers of health care, and placements that youth live in may impose rules that make it difficult to get to a clinic or may have refused to provide transportation in a timely manner due to outdated policies or personal biases. And finally, social workers and caregivers or probation officers have noted that they don't always know what to say or know where to point youth to as far as services, resources, and information when it comes to supporting sexual health care. And so the outcome of that is that there's some avoidance of the issue altogether. And so we'd like to equip people with what they need to better support youth in having access to care. So with that background, I know I covered a lot in a very little bit of time, but please feel free to type in any questions into the control panel, and I'll be happy to answer those during the question and answer session. But I would like to, introduce you to our next panelist, and I am so thrilled to welcome Assemblywoman Blanca Rubio to share about her leadership on this issue and this bill, and to discuss her proposed legislation. So welcome, Assemblywoman Blanca Rubio.
Thank you. Hello, everyone, and thank you for joining today's webinar. As stated, my name is Assemblywoman Blanca Rubio. I'm the proud author of AB 2035, the Healthy Futures for Foster Youth Act. A little bit about my background. This is the beginning of my 4th year in the Assembly, but prior to being in the Assembly, I spent 16 years as a classroom teacher and 13 years as a school board member. And a couple of years ago, I was the chair of the Assembly Human Services Committee, and since my background of teaching, I've dealt and have been in contact with a lot of foster youth that came through my classroom. And so for me, this issue is very near and dear to my heart because I feel like I'm helping that population of kids that I used to teach. And so for me, this is an honor to be able to do something for our foster youth. I've had a piece of legislation every year since I got here to try and address some of these issues. But again, this one in particular is really near and dear to my heart. I don't know if you also know that I was born in Mexico, came here when I was 6, came to the United States when I was 6, and my family and I were deported back to Juarez, Mexico, which is by far the most dangerous city in the world. I'm sure you've heard of the women of Juarez. So Juarez not only is it dangerous for just the general population, but in particular for women. We snuck back into the country when I was 7 years old, and we spent the majority of my school time in downtown LA. And so I've not only as a teacher have had contact with foster youth, but even in my own neighborhood, there was a lot of kids that were in foster care. And so for me, again, it's a privilege to be able to do something that can help some of these outcomes. I don't want to reiterate all the statistics because you did a great job at it, but the one in particular that I do want to highlight, though, is there was a study that, according to this study, the age of first sexual intercourse is younger in the foster youth population than the general population, and the average number of partners is greater. 1 in 6 foster girls in the study reported first sexual activity between the ages of 10 and 12, and 40% were 14 years or younger. That is alarming. We spent the last 2 decades, I think for a while, but in particular the last 2 decades, trying to educate young people, in particular young women, about sexual reproduction and how to avoid pregnancies. And, just our education system does somewhat of a job in trying to educate this population. But me, in particular, being Latina, I just turned 50 last year, and my mom still hasn't talked to me about the birds and the bees. And so I know that statistically, the foster youth system has a lot of children of color. And so on top of the fact that I was a teacher, just the population itself, we don't have open communication in terms of sexual activity, sexual reproduction. So again, for me, it's an honor to be able to do something to assist in this, really, in my opinion, grave issue, because a lot of the population that we are targeting without education end up getting pregnant. And the other statistic that I want to share is that the children born to foster youth are 3 times more likely to have a substantiated report of maltreatment by the age of 5. So it's not just the foster youth that we're helping, but you indicated earlier, it's multi-generational trauma that can be prevented if we simply educate the population of foster kids. So with that, again, I can, go over statistics with you that you already have. But for me, it's not a statistic. For me, it's people that we are servicing, kids that we are servicing. I take my job as a legislator now as if I was still teaching. I explained it to my now 13 and 11-year-old children when I decided to run for the assembly, that my job was to take care of the people of California. And in their minds, they understood what that meant. But I looked at my children and said, this is going to be my job, is to take care of the kids and the people of California. And my kids look to me every day to see that I'm doing that. And I not only want to do right by the foster kids, but I also want to do right by my children and demonstrate to them what it means to be able to take care of folks. And for me, this is my small part, very, very tiny part in this big picture of how we help and help alleviate some of the trauma that some of the foster kids are going to have in their future. You read all the statistics. It is no secret that trauma is going to follow a child in the foster care system. That's just their reality. And so anything that we can do to be able to prevent some of that trauma is, the reason that I am here. And so with that, if you have any questions, I will have a couple closing comments, but I wanted to open it up to see if there's anything else that you would like me to share.
Yeah, thank you so much for that kind welcome and introduction, and just for highlighting the issues and the urgency for this bill. I think folks on the webinar here would like to know what you see as sort of the goals or the outcome of the legislation, both for your district and then statewide, and why this is a healthy and necessary investment to make in our foster youth.
Well, first of all, why is it necessary? Well, I want to reiterate that as a former classroom teacher, I saw the daily struggles of this population. So I also believe strongly in the power of education. As I stated earlier, my parents were not open with me at all, or with my siblings, about anything that had to do with sex. And I ended up learning some of it through my I believe 5th grade sex education class. And some our foster youth don't necessarily have the privilege of being in one school, for their entire career. And so for me, making sure that education is provided regardless of the if they're in the classroom or not, I think is critical, because they skip around. A lot of the foster youth are transient. they go from one school to another. And so for me, being able to somehow get them that information is critical. Again, not just for their own well-being, but in their children's well-being. But I think in the overall picture, a lot of the times when these kids are born, these kids have kids, they become part of the welfare system where we are taking care of them. And I think that if we can educate them early on, we can help prevent some of the issues of not only the trauma, but also putting them in a kind of in a cycle of being on welfare and trying to just survive. And for me, that's really important. And so the hope is that AB 2035 will help ensure that the foster youth receive adequate sexual health education, and that we can improve the outcomes both in my district and throughout California. Like I stated, I do represent the 48th Assembly District, but I took on the role, at least with my kids, that I was going to help take care of the people of California. And so that, for me, is the goal. The investment is necessary, absolutely necessary. Education, we've all heard the cliche or the statement, education is a great equalizer. Well, in this case, it is even more so, because the more education our foster youth have, the less incidence of not just pregnancies, but also sexually transmitted diseases and stigma that come with all of that. I did partner up with Senator Wiener a couple of years ago with foster youth that are LGBTQ. And over and over and over again, after we had hearing after hearing, we heard the same thing from that population as well, is that they were taken advantage of by other people sexually, and basically sex trafficking came into the conversation as well. But when these kids are in the foster care system, not all of them have the privilege of having, supportive parents, and sometimes they fall victims, or a lot of times they fall victims to sexual predators. And the more educated they are, the more help that they can search for and be provided. And so for me, the investment is critical, not just to the foster care population, but also the LGBTQ population. And you stated earlier that population is in need and at a disproportional rate, more so than the regular population. And so for me, those things are important. And we have a group of foster kids that come every year, and I need to be able to look them in the face and be able to tell them that this year we did something to move along their success. And so for me, it's really, really important.
Thank you so much. And just a final question that we have for you, and thank you so much for your time today, is how can folks on this webinar, and how can we sort of as Californians and as organizations, as community members, help to move this legislation, help you in your endeavor here with this proposed legislation, and what can we do that really makes a difference?
Well, as a former teacher, I am going to give you a homework assignment. I believe that the advocacy is a huge component of our success. So I can go to a committee and have the best arguments possible, but at the end of the day, we have to not only convince the committee members, but we have to convince both the Assembly and the Senate. The best way of doing that is, number one, you have to make a phone call. You start with your own legislators. Make sure that you call them and say that you're in support of AB 2035. That's the number one thing. But call other legislators, especially the ones that you don't think may be with us. There is a stigma, obviously, with sex education, and we want to make sure that those folks on both sides of the aisle and on both sides of the argument can hear from you to indicate how important this is. And so the number one is you make sure you call your own legislators, both your assembly member and your senator. Number two, have some kind of a system where you can call other offices, whether it be committee members, and again, both the Assembly and the Senate, make those phone calls as well. And it's important that even though you're not in that person's district, that they know that this is a statewide issue, not just a district issue. Okay. The other thing that I also recommend is writing letters. We've gotten out of the habit of actually writing physical letters. I cannot tell you how many times I get physical letters instead of an email, and I can scan through the emails and I read the headlines and I can skip over it, and I always say, oh, I'm going to come back to it. But the reality is that there's no time. But if there's a stack of letters on my desk, I always read them. I don't know if it's maybe I'm kind of caught in between. I'm a little bit old school and a little bit new school, but I prefer a letter because then I can hold something in my hand when I go to committee and say, look, this is how many people have come and are advocating for this change. And so number one, again, is make those phone calls to your own legislators and to other legislators. Number two is make sure that you write letters. And if some of you are interested in participating and testifying when we go to committee, I'd welcome that as well. Again, there's nothing more valuable than having a face to the problem that we are trying to address. It's very easy for us in Sacramento to look over a bill and just vote yes or no because it's a piece of paper. But it's much more difficult to vote no against a human being that you're looking at in front of you. And so we need that kind of support as well as we need a group of folks to come up when we testify in committee and show their support. Because again, it's so much easier to vote against somebody you're not looking at. But if there's a group of folks in that room, it becomes much more difficult for a member of the committee or a member of the legislature to vote against if they see the person in front of them. And so that is my message. Please stay active, stay engaged, and make sure you communicate with the legislative offices. And there's a couple of ways you can communicate with the office up in Sacramento, but all of us have district offices. So communicate with both. There's a system, it's called LCMS, which is a computer system that we use in our district offices to log who called, how many times they called. So anytime I have a question about a bill, I always have my staff call the district office and say, how many people have called in regards to this issue? And it's very easy for them to give me a number. So I'll give you an example, and I don't want to bring the bill up, but AB5, we've gotten 600 calls about this issue. So to me, 600 calls are the people that were brave enough to call. Can you imagine how many people are not brave enough to call? So I always multiply that 600 by at least 4, because four times as many people were not brave enough to call. So that is always a barometer for me when I vote, either in committee or on the assembly floor. So please, please, please stay engaged. Communicate with your legislators, write letters of support, and bring a group of folks up when we are ready to introduce the bill into committee.
Wonderful. Thank you so much for that insight and advice. And again, thank you for being such a wonderful champion for our youth in care and for championing this bill, AB 2035. I know that we as a community here are so thankful for your leadership, and we will be following up and taking those steps. So thank you so much for your time today.
Thank you, and I appreciate it. And whatever else you need, my staff is always available to answer questions or to take any recommendations. But please make sure that we stay connected because I want to make sure that this bill gets signed by Governor Newsom this October.
Great, thank you. Wonderful.
Okay.
So next on our agenda, we're actually going to hear from Christina, and I will introduce her now. Christina is a 25-year-old Mexican-American single mother, first-generation college student studying public policy, as well as a first-year master's in public administration at the USC Price School of Public Policy. So she proudly identifies herself as a former foster youth, incarcerated youth, homeless youth, and sex trafficking survivor of Los Angeles. At the age of 2, she entered into the foster care system where she experienced many forms of abuse, ranging from systematic negligence, physical, emotional, and sexual exploitation, and she has leaned on education and service work to change her outcome in life. So Christina is an amazing human being who is joining us today, and I'll turn it over now to Christina. Please tell us a little bit about yourself.
Thank you so much for the introduction, and I just want to say thank you so much, Assemblymember Rubio. I love the work that you're doing, and I don't know, I mean, I worked with you last year on AB 1307, we testified together to the state committee, the higher education committee. So it's just a pleasure for me to be able to collaborate once more with you.
And thank you, Christine. Can you take a minute to describe your understanding for the audience here about what is a healthy relationship and what is comprehensive sexual health education? These are some of the components that our legislation will be working towards, and so we're just sort of wanting to hear from you on that.
Yes. So in regards to healthy relationships and sex education and reproductive health to me, it is a form of understanding a multitude of topics, ranging from what is, good, healthy boundaries and relationships, body autonomy. Also, too, it elaborates on how, to take measures to be safe and be protected and be aware of the diseases out there, as well as just your individual rights. I do see within the foster care system there is definitely a lack. That this conversation in general is just lacking in the education system and within the communities at large. So in regards to the foster youth population, I feel that not only is this topic not being discussed and really not being able to be open to have transparent conversations with our youth, but the curriculum itself shouldn't just be the ones that are already approved through the state and being taught in the K through 12 systems already. I feel that those conversations are completely different and they're not tailored to our specific demographic. So when we do have this sex education talk or reproductive health talk, it's coming very, very much from a different lens and being taught not to the demographic that we are. So what I mean by that is, I really would love to see curriculum developed that is not just basic healthy sex education or understanding your rights, but also making sure that it's trauma informed. And I think that's a huge disadvantage that I'm currently seeing and that I faced, is that when we did have these talks about sex and about pregnancies, these are very vulnerable conversations for our youth, especially because we have such high rates of being, abused ourselves. So the language of just sex in general is hard to address.
Thank you, Christina, for that insight. And can you tell us a little bit about some of the barriers to care that you have experienced and how you've overcome those barriers?
Yes. So some of the barriers that I personally went through was, one, just the lack of trust and transparency between providers and its participants. There's a large disconnect. I think some of it has to do with systemic issues in regards to like the punitive practice and style. Therefore, our youth aren't comfortable having vulnerable conversations. So building that trust is definitely going to be key for foster youth to be able to open up. But on some more tangible aspects, I would have to say one of the biggest things that I struggled with was I didn't have access to like my insurance cards. I didn't have access to my records or even, who was my healthcare provider. All of that was taken care of me through the programs that I was in and the SGRPs and all of those residential facilities. So therefore, even though I have the right to go to a clinic, I don't have proper information to allow me to get services sometimes in clinics. So in having access to our insurance cards and our information is going to be vital. Another one, obviously, is transportation. It's just really, there's a lack of transportation, and we don't have systems in place to make these routes for our girls and boys. And then also, too, just there's a lot of compensation? No. I don't know how I'm not saying that word correctly. Compensation. Oh my goodness. But pretty much
I think you're saying confiscation, like when they take it away.
Yes. Yes, thank you. Sorry. So we're not a lot of us weren't allowed to have certain things that promoted, sexual activity. So if we did get contraceptions, we wouldn't be able to have them, or we would have to check them in and out. And who's going to do that? So those are some tangible barriers that I see and that I have experienced myself.
I see. Thank you for sharing that. And just to sort of close off today for your portion, what would you like folks listening in on the webinar to do? How do you think that they can be supportive?
I definitely think that we need to continue researching first this topic, producing attitude surveys within the community, implementing educational workshops. Also, statewide and state and local data collection is definitely going to be significant to document the sexual and reproductive health outcomes. So I'm always championing research. I would love to see a creation of local and state policies to be a tool to enforce requirements that integrate sexual education that is tailored specifically to our demographic, that is trauma informed, that does talk about not only healthy relationships and our reproductive rights, but also to be more tailored is bringing up the conversations of human trafficking, bringing up the conversations of pregnancy, because these are, and partner domestic violence, all of these different things. But it needs to be more tailored to the demographic that it's serving. I don't think basic sex education 101 is smart to even talk to our youth just directly about, because we experience so much trauma. So I do want to see a more tailored curriculum that is evidence-based, that does protect the youth just from the conversation of sex, in regards to so many of us have been raped and molested ourselves. So I would love to see that. And again, I would like to see create local and state policies that enforce requirements to integrate sex education into caseworker sessions, programming, so then they are mandatorily have to implement. That's what I would like to see. And then also too, I do champion what Assembly Member Rubio said, is to allow youth to advocate and lobby for this bill at the state level. So when that time comes, I hope that there is representation there. A youth as myself, I always am willing to do that, but I definitely want to see continuous representation through this conversation, and creating creating spaces so we can have more of these conversations. So annual conferences where youth are gathering and together and learning about these specific things is going to be key.
Wonderful. Well, thank you so much, Christina, for your advice here and for sharing your insight with everyone on the webinar today. And again, for folks listening in, please type in your questions both for Christina and for the Assemblywoman into the control panel, and we'll answer those during the question and answer session. So for the next part of our webinar, what I'd like to do is have Luciana Spidler from the Children's Law Center of Los Angeles talk about essentially the current law that is the basis for AB 2035. So our current law actually is what we're building upon with the proposed legislation by Assemblywoman Rubio. So Luciana can go ahead, and could you please provide us with that background and context?
Sure. Thank you, Anna. And yes, so to cover a little about SB 89, in an effort to address some of the discrepancies in outcomes and other concerns that have been discussed earlier in the webinar by our other speakers, In 2017, the legislature approved SB 89, which was the California Foster Youth Sexual Health Act. And the bill's goals were several. One of them was to improve access to sexual health education for all youth in care, to inform foster youth of their rights as they relate to their reproductive and sexual health, and to remove any barriers that youth may face. And as we heard from Christina, they face many. And finally, it aimed to strengthen the knowledge by requiring quality sexual health education training for caregivers, case managers, and judges. So I'll explain a little more in detail on these three requirements of SB 89. So as far as SB 89 training requirements, the requirements were for adults who are responsible for taking care and providing support for our youth in care. So that specifically is for county social workers and probation officers. Requires training for judges, resource families, and doing the pre-approval training. So those are folks who are going through the resource family approval process. And finally, STRTP or group home administrators doing their certification training. So very specific who is required to get the training. And the topics that are required to be included in the training are the same for all, and that includes the reproductive and sexual health rights of youth in care, the duties of caregivers and case managers related to these rights. It's supposed to cover how to document the information in a case plan, how to engage with youth about sexual and reproductive health, and finally, information about contraception methods and additional resources in the community. And since SB 89 was implemented back in 2017, there have been trainings developed to meet some of these requirements, some of which are listed in this slide, including CalSWEC's case manager training. They also have an e-learning training. There's CDSS's caregiver training, and J-based pre-approval training. And all of these trainings could be found in the link on the slide, and that's in John Byrne Advocates for Youth website.
Work on it after your webinar? Could Brian work on it? I don't know. I haven't texted him yet.
If I can hear some voices, so if you could just mute your phone, that would be great. Thank you.
Do today. I mean, I can, but I don't usually do them.
Hello? Can you mute your phone, please? Thank you. So as I mentioned earlier, one of the barriers for foster youth in this area is inconsistent access to comprehensive sex ed in schools. This is due mostly to placement changes, school instability. So we don't see our youth in care receiving the comprehensive sex ed that is required by law as often or regularly as other youth in the community. So SB 89 hopes to address this barrier by requiring case managers to verify and document in a case plan for all youth who are 10 years of age and older and non-minor dependents that they have received or will receive the required comprehensive sex ed curriculum at least one time in middle school and at least one time in high school. And if in doing their search to inquire about the curriculum, they find out that the youth is not scheduled to receive or has maybe missed the curriculum at school, the case manager is also required to document how the agency will ensure that the youth will receive the curriculum outside of the school. Some resources that we think might be helpful in implementing this provision of SB 89 have also been put together by JB in their website, and the link is on the slide. But basically, you can find a list of California's comprehensive sexual education providers. JB has put on a webinar on this issue. There's a list of California's Planned Parenthood offices throughout the state, and then there's also CDSS has issued guidance on how to document the comprehensive sex ed requirement of SB 89. So again, all these resources are available to you. You could be linked to them through the JBay website. And finally, SB 89 also requires case managers and probation officers to document in the case plan that they have informed a youth that, again, is 10 years of age or older and non minor dependents of the youth's right to access age appropriate, medically accurate information about reproductive and sexual health care, about their right to consent to sexual and reproductive health services, and his or her confidentiality rights regarding those services. And finally, they must document in the case plan how to access reproductive and sexual health care services and that they have facilitated access to that care, including assisting with any identified barriers. So if the social worker, case manager, probation officer has assisted the youth in getting care or removed any barriers to them getting the care, all this information must now be documented in a case plan. And once again, we're providing you with some resources that we hope will be helpful in addressing this requirement of SB 89 and how to start some of these conversations that are now required by SB 89 that we're asking case managers and probation officers to have with the youth. And some of this information is the CDSS Sexual and Reproductive Health Rights Youth Brochure. This is a really great brochure issued by CDSS that lists all of the rights of youth as it relates to the reproductive and sexual health rights. It is written in a youth-friendly voice, so it is a wonderful document to use when speaking with youth and when informing youth of their rights. JBay and LA Rep has developed handouts that are age appropriate. So there's 3 different handouts depending on the age group of the youth that you will be speaking with. That includes facts and additional resources on having conversations. And there has been previous webinars on this issue that would be helpful to watch. And those are the rights of that have been put in place by SB 89.
Thank you so much, Luciana, for sharing that current legal context and what our current laws are, and for just providing that advocacy and background, and for taking a lead in the drafting of Assembly Bill 2035 and the changes that we're seeking moving forward. So again, for everyone on the webinar, Luciana just pointed out some of those links. Everything is in the handout section of the control panel, so you can download that PowerPoint and have that link access. So the next part of our webinar, we're actually going to talk about where do we go from SB 89 into AB 2035, so, and why is that needed? So our next speaker is actually a young person named Darian, who is a student attending Sacramento State, majoring in nursing, and Darian hopes to graduate with her nursing degree and in her future to get her master's degree. Darian has experienced foster care and hopes to share her experience to help others. And Darian is new to our John Byrne Advocates for Youth team and is excited to work with us this year, particularly in advancing this bill. So Darian, if you can unmute your phone and tell us a little bit about yourself.
Hi, I'm Darian. I go to Sac State. I was in foster care, and I am in extended foster care at AB 12 right now. And then I'm just here today to talk to you guys about the importance of sexual and reproduction health.
Thank you. So Darian, can you share a little bit about your time in care? And I know you're in extended foster care right now. Did you receive the comprehensive sexual health education that was required by SB 89 as part of middle or high school?
No, I did not. Like during when I was in the care, I didn't receive it or didn't get like the talk from my foster parents at the time.
And did you receive it in school?
The only time I did receive any form of information about sexual health and reproduction was my 8th grade class, and that was about as close as I got, but they didn't, go into depth about STIs, teen pregnancy, and stuff like that. We were kind of just basically learning about like the body parts, and that was really it.
Okay, thanks for sharing that. So, you mentioned that you were not able to access the comprehensive sexual health education during high school or through your caregiver. Can you tell us about, as you were kind of growing up in foster care, what barriers to care that you experienced and how you overcame those?
Okay, yeah. Um, so some barriers I experienced, I went to find out things like by myself. So I wasn't able to get like an adult perspective. So I kind of just went to like a Planned Parenthood by myself when I felt I was ready to go. And when I went, I wasn't able to get service because I didn't have like my health insurance card. And when I asked for it, I wasn't able to get it because they told me I was too young to have my own like card by myself. Um, so I kind of had to go search for my card by myself and had to go the extra mile to get information that I should have access to. Um, and that's pretty much some of the barriers I went through with this experience. Yeah.
Mm-hmm. Thanks for sharing that. So, you mentioned that you didn't really talk about this with your caregiver at school and that you kind of sought out information on your own. But for folks that are calling in from the webinar, how do you think that caregivers and caseworkers can help in sort of use a knowledge base in accessing service and care?
I think that caregivers and foster parents, they should be able to sit down and talk with the youth and help with doctor's appointments and suggesting how to have a conversation if you feel like you're ready to with your doctor. Also, I think it's good to establish a sense of trust because it's really hard, to open up um, about that particular subject and then when you feel uncomfortable. So, and also be able to give the youth access, to their Medi-Cal card or um, anything they need, basically, in order for them to get um, the right care that they need for whatever situation they're in, or they feel like they want to go control, or yeah.
Mm-hmm. Great. Thank you so much, Darian, for joining us today and for sharing that perspective of, sort of where we're at as far as implementation of SB 89 in the state and how we can improve upon that. And just so the audience knows, I know Darian's caregiver at the time would not yet have received the pre-approval training that SB 89 required, and that's something that we're going to have our next speaker kind of talk about. So thank you again, Darian. If anyone has questions for Darian, please go ahead and type those into the control panel and we'll answer those at the end. And next, we want to hear from Shari Schroeder. So for more than 3 decades, Shari Schroeder has worked tirelessly to improve the lives of abused and neglected children and is the director of Woodland Community College Foster and Kinship Care Education Program. Schroeder has built a reputation for offering quality classes, building community connections, and supporting caregivers. Under her leadership and coordination, recruitment and retention of foster care has increased dramatically, and the transition from traditional licensing to resource family approval under the continuum of care has been positive and encouraging. And Schroeder has firsthand knowledge of these issues faced by caregivers. She and her husband have welcomed several teens and a non-minor dependent into their home. As Yolo County began to implement CCR, Schroeder was instrumental in helping caregivers navigate the changes and potential challenges, and it has been her drive to secure positive, well-trained resource families that bridge connections between foster parents, social workers, and community groups. So, Shari, thank you so much for joining us today. Can you tell us a little bit about foster and kinship caregiver education?
So thank you for having me, and thank you for that beautiful introduction. So as you can tell, if someone's done a job for over 3 decades, I've been doing it a very long time. And foster and kinship care education came to California community colleges back in 1985. And I think I've been very lucky. I stepped into this right outside of graduate school, and I had lived with my uncle and my aunt as a teen, and then as a young adult, I went back and forth to them once I started going to college. So this was something I felt like it was passionate. I have siblings that have really struggled with just kind of finding their way through life with addiction and different decisions. And so it's just been a real blessing to do this over the course of the time for probably about 25 of these 30 years. I've also been a regional coordinator serving to help other community college programs build their curriculum, resources, families, and actually this has been a topic that we've really brought to the table our last two meetings.
Great, thank you so much, Shari. So you actually run a foster and kinship care education program at Woodland Community College. You're a foster parent. And so in your experience, why is training resource families on sexual and reproductive health for foster youth important?
Well, I really appreciate following such amazing speakers right before me, particularly Assemblywoman Blanca Rubio, who talked about, even in a birth family, a family of origin, bringing up the topic of sex and sexual health and well-being and contraception. Pregnancy prevention is not something that very many adults are very comfortable with birth children, let alone having a child that's coming into their home. So I think that there are many myths and presumptions and fears that are really held by our caregivers. And I've seen this every single month when I bring in a new group of prospective resource parents. They really do not know what their obligations, and they just operate with a lot of fear. So, for example, when a youth asks for access about going to a clinic to get birth control, most foster parents, when asked that question, feel like it is not their duty or responsibility. In fact, they're very afraid to do that, when the truth is we as caregivers are the people. We're supposed to take our young people that are with us in our homes to attain the health care that they need. And that means driving them to a clinic if they ask to be driven to that clinic. We are the ones that oftentimes hold their Medi-Cal cards and their documents and their paperwork. And what I would try to help you understand, particularly as a trauma-informed caregiver, is that we want to become that go-to person that they would come to and kind of be that open facility of information and sharing of that. I also think, just as I listened to the speakers before, there's so much fear around all of this. So many people just don't want to talk about their bodies, contraception, STDs, and pregnancies. I know in my own family growing up, I don't think I ever heard my mother say the word sex, let alone talk about my body. And I know my sister had found a way to go on contraception. For example, my mother's solution to that was to take the pills that she had found and throw them away. And my sister ultimately ended up being a mother when she wasn't ready for that. So I felt it and I see it, and I certainly don't want that to happen to children in my care, and I want to help others in our foster and kinship care education programs feel comfortable as they share this out. So I think I can use one example, and I think it's already been shared here a little bit. There's a young woman, actually, when I wrote my introduction, my husband and I have been doing foster care for about 20 years and probably have had 30 or so young children. Our youngest has been 12, and some have stayed, just for a few days, and others 5 years and are now young adults and doing quite well. But there's a young woman that had stayed with me for just a very brief period of time, went on to live with a foster father that she had known when she was a younger child. It wasn't her birth father, but somebody she'd identified as a father. And she found herself in a crisis situation, and she felt like she couldn't go to this man who was responsible for her because it just wasn't a conversation that had ever been had. Foster dad really held this belief that he was not the person that was supposed to be talking to her about this, and in fact had told her she wasn't supposed to have sex. That was the message she'd been given. When she found herself in a crisis situation, she ended up feeling just like had been shared here. She had no transportation, no resources, no Medi-Cal card, no ability to really go and do what she really felt was a personal choice in the situation that she found herself in. And it just felt incredibly tragic. And for all of you on the phone, we did reach out and certainly help her with the situation she was in. It just feels so hard and awkward when it's not the person that really, in your mind, should be the person that's there to support and help you, which is the caregiver. So I think training is incredibly important. I think that many of us just need to learn how to do this. So I really love this legislation coming forward, that it's really sharing with us not only as caregivers our responsibilities, but also how to address and bring the topic of intimate relationships and sex and STDs and contraception and personal choices to the table. And I think they need to be trauma-informed conversations, which I appreciate having heard as it's come through, because again, I think this is the interesting part. I take children into our home, my husband and I, on an emergency basis. I have never met most of the young people I've never met before. They've never seen me. They've never been to my home. And the last thing they're going to want to do is talk to someone like myself, a stranger, about something as scary as sex and contraception. So I think that, as one of my daughters always would say, well, that was awkward. And I think it's my responsibility as a caregiver, and it's my responsibility as an educator to help people know, yes, indeed, it's awkward. And as the adult, it's my responsibility to put this on the table. So I think that we do need to know the right answers. We need to know, as a caregiver, what is our responsibility? What is it that we are supposed to do for our youth? Do we have access to the brochures that are helping us to know what the youth's rights are? Are we sharing that with the youth? Have we read them? And I think without training and education, most adults are stopped by fear, and then unfortunately they don't do the right thing. And the resulting situation is just what we've seen statistically, is a group of young people who don't always know how to take care of their bodies. They don't really know how to navigate relationships, what I call the good, the bad, and the ugly. Sometimes when they go off to the side, they don't know where to ask or go for help. And unfortunately, I feel they're left feeling alone when it comes to their sexual health, preventing pregnancy. And ultimately, we see a lot of poor outcomes, not only for the young people that have been entrusted to our care, but also the babies that are going to be born that don't necessarily get all the supports and services they need prenatally as well.
Thank you. So you currently run the Foster and Kinship Care Education Pre-Approval Education Program, and part of that curriculum does require some of the basics on sexual and reproductive health. So why would it still be important to cover sexual and reproductive education for all resource families?
I think this is a critical question. So I think what the state has done so far has been a really great first step in developing the California Department of Social Services website, which has already been mentioned and addressed, and the information that John Burton and so many of the other nonprofits are putting out. So when I am in class and doing pre-approval for resource families, we do pull up the CDSS website. We address and show some of the resources that are available. And I think it's really important that everybody knows that those resources are there and available. However, there's two reasons why I don't feel like it's enough. So first, people like me, I was a traditional licensed foster parent in a county. So I did convert over. So I have done the resource family approval training. However, I did it in an early cohort when this legislation was not in place. So any of us that were licensed foster parents, or any of us that were early resource families, were not given any curriculum required. There was no required curriculum on healthy sexual development. Second to that is that when you look at pre-approval training, I appreciate that caregivers are required to get information prior to having children come into their home. So the state requirement is 12 hours to cover 22 curriculum topics. So you can do the math. It's just not an opportunity. There's not enough time for an instructional specialist within a foster and kinship care education program or another nonprofit that's been tasked with this pre-approval training to really cover sexual and reproductive health, the rights of youth in foster care, the obligations of foster parents, how to develop and bring that supportive conversation to the table. It's just an unfortunate situation that time doesn't really permit ample conversations for this. And I think we just need to spend a lot more time on the topic. It needs to be a required ongoing education requirement for everybody that's bringing children into their homes. I always like to tell everybody who walks through the door, yes, I can appreciate that you're only going to foster a baby or a toddler or a school-age child. And I think even statistically, we've heard our children coming into care have sexual contact earlier. They are sexually more active. And the reality is all little kids grow up to be teenagers and young adults. And we're all sexual beings. And it's just part of the conversation that needs to be had. I think it's best when all of these relationships or all of these conversations are built around relationship. And I think having those conversations in a class allows caregivers to know who they can email, who they can pick up the phone, who they can call when they have questions and are looking for guidance.
Thank you so much, Shari. And do you think foster parents appreciate this education?
So I love this question as well. So we do this curriculum every single month. I do pre-approval training, and I always start off with just asking 3 basic questions. And one of those questions is, who is required to drive a child to a clinic appointment if they're choosing to attain contraception or make some personal choices around pregnancy? And I always have people just raise their hands, and I've yet to have a class where anybody gets that question right, when in the reality it's the caregiver that is to do this. And they always want to think it's the social worker or they have to have a court order, that it's just something so beyond their norm. So I do think that they're very grateful. And in fact, for my program, I put together a handbook and tried to give them as much information as I possibly can that when they walk out the door, because they do really want to know, what are they allowed to do? What are they expected to do? And can they do it right? And as a caregiver, I think I can speak on behalf of all of California's caregivers when I say the last thing we want is for something bad to happen to a young person while they're under our care and living in our homes. That we really do not to have to want to face somebody, perhaps a social worker, attorney, a CASA, or the judge, and have them look at us and ask, why didn't we keep this child safe? Why didn't we provide the services and supports to them that they were asking for? And the answer isn't, I didn't know, because really we all really should be responsible to know that. So I just feel like it's really, people want to know, they want to know, we all want to know what our job entails. We want to know how to do it. We want to know where to get the answers, as do our young people, so do the caregivers. And we're really tasked with keeping our children safe when they're brought to our homes. I think sexual health and reproductive education gives us, the California caregivers, the information and the tools that we really need to have and hold, so that we can be confident, that we know that we're following the guidelines, that we know that we should send our children to that 5th grade and 8th grade sex education classes, that is our responsibility, and that we know what has really been tasked to us to do best for the children, the teens, and the young adults who are brought to our care. So I really appreciate being able to share this out. And I know as a caregiver, I just feel so lucky that I get to sit at the table and hear all of this. And I feel more prepared so that I can turn around and go out and do my best job preparing others.
Thank you so much, Shari. And thank you to Darian as well for providing that deeper context for us. I think now that we've had this context of how things are currently, we can dive into the provisions of AB 2035 and what this bill is seeking to kind of do on top of what our current law already provides, and on top of the resources that are already out there. How can we build upon that base, which is very strong? So thank you to both of you. And now I'm going to turn it over to Rebecca Goodman, who is from the National Center for Youth Law, and is going to talk to us about the provisions of the bill itself.
Thanks, Anna. So we've clearly heard why this is so important, and Luciana summarized some of the first important steps that we took as a state to try to address ensuring that young people in care can get the comprehensive sexual health education and access to services that they need and deserve. Senate Bill 89 was passed and went into effect in 2017, and now we have the benefit of a few years and feedback from the community to understand what we need to do to really bring the goal of Senate Bill 89 and the goal that we've all put out there today to fruition. And that's what we've wrapped up in AB 2035. There's 3 broad components to AB 2035. I'm going to summarize them, and then I'll talk about each one in a little depth. The first is a training requirement for resource families. Second is a component that will ensure that attorneys for children and parents, as well as judges, juvenile judges, are kept in the loop about the education and resource needs of young people who are under their responsibility. And the third is a really interesting component that will help us to develop some metrics to track progress and create some public reporting so that we can all fine-tune and improve the services and support that we're providing young people. So let's look at each of these in some depth. I'll start first with the training component. And could we go to the next slide, please. Thank you. So as Shari so eloquently explained, and several of our other speakers, caregivers really do need reliable, comprehensive information so that they know how to support youth, both understanding the scope of the law and their obligations, but also how to have what can feel like really hard conversations in a supportive, age-appropriate, trauma-informed way. We know caregivers want this information, and we know youth wish they had it. Thanks to Senate Bill 89, there is just such a training now as part of pre-approval for resource families, as Shari mentioned. But as she mentioned, that we've realized that that isn't quite enough, partly because there are some folks who received their license before Senate Bill 89 went into effect and never got that training, and partly because the training, the time allotment is so brief. And as Shari said, this is sort of an ongoing training, and oftentimes not something you realize you need until you're in the moment of having that 15-year-old in your home or that 12-year-old in the home. So this first component of AB 2035 will address this by bringing training to the group who missed training during pre-approval and who are looking for more in-depth training. There already is a requirement in the state that resource families receive 8 hours of annual training each year to keep their license up. So there's already a mechanism for training. And what AB 2035 would do is add training on how to support the healthy sexual development of youth as a required component of this annual resource family training. AB 2035 says the curriculum for this annual training would be the exact same curriculums currently required for SB 89 pre-approval. And as noted on some earlier slides, there are already a number of compliant trainings out there, both online and in person. And so hopefully it wouldn't be too much of a heavy lift to create resources so that resource families could obtain this training, addressing their obligations, the rights of young people, and critically, how to support young people and have trauma-informed, strengths-based conversations in that space that Shari so perfectly described as awkward for all of us. The second component of AB 2035 helps ensure judges and attorneys are informed and able to support ensuring that foster youth have the same access to education and services as other youth. As Luciana explained earlier, Senate Bill 89 took an important first step by requiring that social workers and probation officers, those who are supervising youth in the foster care system, that they are informing youth 10 and older about their rights, about where to find age-appropriate and medically accurate information, and confirming that youth have received mandatory comprehensive sex ed in schools. When they haven't been able to receive it in schools, Senate Bill 89 requires that the Child Welfare Agency connect them to an equivalent education program in the community. Senate Bill 89 also required caseworkers to document that they've done all of these things in a youth case plan, which is part of the CWS CMS database. That's, for those of you who aren't familiar, that's part of the Department of Social Services online computer database. However, judges and attorneys do not always have access to this case plan or to the CWS CMS database. That means they would have no way of knowing whether a youth who missed comprehensive sexual health education in middle school needs to be connected to a program in the community, or whether a youth who's in front of them in court or who they represent has faced barriers, for example, not having access to a Medi-Cal card or not having an easy way to get transportation to a clinic. AB 2035 would change that and help ensure that both the attorneys and judges are kept in the loop about the particular needs or barriers that young people are facing by requiring that the information currently being inputted in CWS CMS also be put into something called the court report. The court report is information that gets filed with the court and is accessible to attorneys and judges. It's a relatively small step, but it will make a really important difference in terms of ensuring that the folks who are also part of who have the responsibility for ensuring young people receive the health and education that they need and deserve, that they're part of that and find out in a timely way and can help work in conjunction with caseworkers and caregivers to make sure that barriers are addressed and that services are provided in a timely way. The final component of AB 2035 is a data component. The only way we know about the health outcomes that youth have faced in the past, much of the data that was provided up front in this training, is through privately funded research. It is really important to know whether the new rules and tools that the state has invested in through Senate Bill 89 and the resources that have come from the Department of Social Services, if they are being implemented and whether they are actually making a difference in the lives of youth. The only way to know that is by getting information. And in fact, one of our earlier speakers highlighted the real importance of having data. There are 3 different state agencies with important information that can help us understand how things are moving forward in terms of education and access to services for young people in foster care. The Department of Social Services has really valuable data on the implementation of caseworker efforts related to training, informing youth, and even ensuring that they're connected to sex ed, whether in school or in the community. The Department of Social Services also has important demographic data on youth in care. The Department of Healthcare Services has data from Medi-Cal and other health insurance programs that can tell us the kinds of healthcare services that young people are accessing, whether it's prenatal care in a timely way, access to contraceptive counseling, etc. And the Department of Public Health has similarly important information related to STIs and STDs, including some of those that are currently at epidemic rates in our adolescent population in the state. It is actually possible to leverage some data sharing agreements that already exist between these agencies to match information and develop a really robust picture of the sexual and reproductive health outcomes for youth in care. And that's what AB 2035, the final component of the bill, would do. It would ask the Department of Social Services to partner with some of these other agencies, Department of Health and Department of Public Health, to match data and develop de-identified aggregate information, so nothing that shares the private information of any specific young person in care, but that can tell us in a broad way how the state is doing in meeting the needs of youth and how youth are doing over time. It also would ask for some performance data to be reported out so that we know whether training really is getting out into the field and it would help us better target any additional support that might be needed in the future. AB 2035 asks that some of this information be separated out so that we can see how youth are doing by race, gender, sexual orientation, and type of placement, among other things, to again see if there are some places and spaces in which we really need to target more additional support. I want to emphasize again that AB 2035 would protect and honor privacy and ensure no data is released that has any possibility of identifying any particular youth. This is really about trying to ensure that the work we're doing is having an impact on the ground and help us watch for ways to improve whether we're actually improving health outcomes over time. Since the state is the legal custodian for youth who are in the foster care system, it really is important that the state know how youth are doing. And so that's what this final piece of the bill would allow us to do moving forward.
Thank you so much, Rebecca, for that walkthrough of the legal language in the bill. That legal language can be found using our website for everyone, and I'll show you how to get there in a minute. But these components that Rebecca just talked about actually do come with a cost, but it's a really modest investment and a necessary investment, as Assemblywoman Rubio mentioned. So to update the training, guidance, and dissemination, to update the rules of court and forms, and to hire those data positions that would be needed in year one, we're asking for just under $300,000. That does come with a federal match to support that. So we would have some federal support there. And then ongoing for the online and classroom trainings that would be provided, the annual update to the court report, which is the caseworkers' time, probation, and social workers entering that information into the court report, does come with a cost, as well as those 2 full-time data positions to merge the data sets, to analyze it, to report on it. It's all what would be needed in order to resource this bill. The good news is that with a 50% federal match, it makes it very affordable. And I would like to talk for a minute about why this very modest investment could actually lead to huge cost savings for the state, as well as healthier futures for foster youth. So we're actually looking at the way that we're currently sort of doing does come with its own set of costs. So comprehensive and sexual health education is one of the strategies that the Center for Disease Control and Prevention, as well as SAMHSA, have said actually lead to a reduction in things like intimate partner violence, sexually transmitted infections. Access to care and prenatal and postnatal care can improve the health of the mother and the child, and can we'll see decreasing rates of stillbirth and miscarriage as we see increases in prenatal and postnatal care. We'll see increases in healthier relationships, in contraceptive counseling, and healthier births. There are very real costs that come with each of sort of our status quo of operating around sexual and reproductive health. There are court, hospital, and personal costs that are tied to intimate partner violence. In some of our fact sheets, we give those actual hard numbers. It is in the billions of dollars, and for just one person, if we prevent one case of intimate partner violence through comprehensive sexual health education, we would have already paid back the annual appropriation for this bill. The treatment costs and hospital costs for sexually transmitted infections alone, we also have those numbers. These are some really large investments for something that can be prevented through contraceptive use and access to contraception. So we want to really emphasize that part of this bill, as well as the education and employment costs that come from being pregnant, parenting, and birthing a child, where you're out of the workforce for a period. Your employment can be impacted by that caregiver role, especially for our younger youth who would be attending school or post-secondary and in the employment and labor field. So there's a lot that can be changed about our current spending by making this modest investment. And we also know that investing in this way will lead to healthier outcomes for youth, which ultimately does save the state money. So the next thing that I'd like to share with all of you is just how you can get involved. And thank you so much for staying with us through this webinar and for hearing more about the bill and just for being here as partners in this work. First, I'd like to talk about our legislative timeline. The governor has released his budget as of January 10th. Throughout February and March, there are budget hearings that will happen. On this issue, there will be a budget hearing on March 25th, and so we'll invite you to that. The governor then releases his May revise, which will revise that, and the legislature works with the governor to approve and pass a final budget by June 15th. So between now and June 15th, we really want to work to get those costs and that appropriation into our state general fund. On the bill side for AB 2035, the deadline was last Friday to introduce bills. So our bill was introduced. We do have our bill number and information by Assemblywoman Rubio. We'll be going to the Assembly Human Services Committee first, and then we'll be going to the Assembly Appropriations Committee. All of that has to pass out of the Assembly by May 29th. Then we'll go to the other side of the House to the Senate, go through the same process there. All bills have to pass by August 31st, and then they would go to the governor's desk to be signed. September 30th is the last day for Governor Newsom to sign or veto bills, and then the bill would go into effect in January 1 of 2021. So, as the Assemblywoman mentioned, getting a bill passed can come with its own challenges. So there is some instability at the federal level, which creates uncertainty at the state level, particularly in the budget. There's a lot of bills that have been introduced this year that have competing kind of worth and priorities. There are a lot of foster care bills, and there's been some mention of concern about the economy from the governor and from the Department of Finance, mentioning potential downturns in the future and only wanting to appropriate one-time funding. So in order to get that $600,000 of ongoing funding, we will have to do a lot of work and advocacy to make sure that Healthy Futures for Foster Youth is supported. And so how we do that is we're actually asking you to join our coalition. You can do so by clicking on the link in the slides here. What we will do is just email you when we have our hearing dates. We'll ask for letters of support, and we'll really keep email to a minimum, but this will make it so it'll be very easy for you to support the bill with very little time commitment. So just sort of staying in touch. So please take a moment to click on that link to download the handouts from the slide and to join us by filling out this form. The form should take less than 1 minute. We're just asking for your name, your email, and how you'd like to be connected. There's some options there. Another thing that you can do to support AB 2035 is to send in a letter of support. So we do have this template. It's also in the handouts, and you can fill that out, put it on your own letterhead or your organization's letterhead, and email it to support@jbay.org. And you can also add your organization's name and logo to our budget letter asking for the funding that we mentioned by sending your logo to that same email. So again, that's in the handouts part of the control panel, and we would love to have your support on this bill. Another thing you can do, as the Assemblywoman mentioned, is attend and testify at Budget and Policy Committee hearings. So we will go to Assembly Human Services. That date is not yet set, but if you fill out that coalition link, we will let you know, and you can join us at the Capitol, or you could call your member and ensure that they'll be voting in support of it before that date. We have a hearing on March 25th at 2:30 p.m. at the state capitol. You can let us know if you'd like to join us at that hearing, testify, and give public comment. And again, if you fill out that coalition link, we'll let you know when the other hearings are scheduled. As the member mentioned, you can meet with legislators in your district. Usually they're in their district on Fridays. And if you'd like any help preparing or organizing an event, you can actually email me, and I'd be happy to support that meeting with you. It's a great opportunity for young people, and legislators like hearing from the people that they represent, as you heard from Assemblymember Rubio herself. Another thing that you can do is follow JBay on social media, and that does help promote the bill and get the word out. So please feel free to click on any of these links and to follow us to share, like, retweet, and repost our information. And with that, I will just sort of say that, again, this whole presentation will be posted in our training archive. The coalition link is posted here. And I'd just like to go over any final questions that people may have, as we have just 1 minute left on our time today, but I'll stay on the line to answer any questions. And this will be posted. So please feel free to take a moment to type in your questions, and we'll start to answer those now. So the first question that I'm seeing is it possible to get a copy of this PowerPoint? Yes, it's actually in the handout section of the webinar, and it will be posted on our website in the training archives. Another question that I'm seeing is, what would the speaker like to see happen on the subject in a STRTP in a facility or in a foster home? Would providing a copy of the health insurance to each youth help? At what age and when should the conversations occur? What would help make the youth more comfortable to have these talks? So actually, Diana asked that question, and I'll send to you, Diana, an email with an answer to that. Anyone else that wants to know more about our initiative about supporting STRTPs on this issue, there's a learning community that will have a kickoff in March, and we would love to invite you to that. So Diana, I will send you more information. There's a question from Julie that, that the case manager was ultimately responsible for transportation. And if a caregiver is not comfortable providing transportation for sexual and reproductive services, can they refuse? And so I'd like to turn that question over to Rebecca, if you could please answer that question.
Yeah, that's a great question. The caregiver has an obligation to ensure that a young person has access to transportation. It doesn't mean that they explicitly have to provide it themselves. If that means that they need to coordinate with the caseworker and ask for support or ask someone else, but they do have an obligation to not just ignore a request for transportation, but make sure that any transportation needs are met in a timely way. There's a lot of fabulous, as mentioned in the question, fabulous resources on the CDSS website. They've issued a number of different guidance documents, ACINs and ACLs, that really lay out the obligations of caseworkers and caregivers and how they work together to make sure that needs are met. So I would refer folks to those for sort of more specific information and advice.
Great, thank you, Rebecca. There's another question, Rebecca, that if you'd be able to answer is, what do we do when school boards are against implementation of, I'm assuming that means implementing the comprehensive sexual health education curriculum itself? And how could that kind of relate to what this bill, and maybe talk to the data portion of our bill and how that could be helpful?
That's a really good question. In 2016, California passed the California Healthy Youth Act, which requires every public school in the state, every middle school and public high school, to provide a comprehensive sexual health education, and the curriculum must meet certain standards. It must cover healthy relationships and consent and issues related to sexual orientation and gender identity. It has to cover sexual trafficking and a real broad array of topics. It has been a slow transition to get school boards and schools to adopt curriculum and to adopt curriculum that meet the standards that the state has now set forth. And I should also note that now, as of last year, charter schools also have to provide these curriculum. Parents can opt a child out of a curriculum, but the school board and school district do not have the choice whether or not to provide it. They must provide it. The reality is that there are some school districts that have yet to implement the appropriate curriculum, and in those places, the Child Welfare Agency may be able to catch that before others do, because they're now trying to track delivery of comprehensive sexual health education. And anyone who finds a district or a board who's refusing to implement, whether you're a child welfare agency or a caregiver or just a concerned individual, you can contact the State Department of Education, because they are supposed to help implement this, and they are interested in knowing if there are districts or boards who may need just a little bit more information and education about what's out there. So if anyone wants more information on who to contact or how to contact the California Department of Education, we can get that out to those of you who attended the webinar today.
Great, thank you, Rebecca. And there's a couple more questions that I'll read one now for Rebecca to answer, and then I'll read one for Shari to answer after that. So Rebecca, many foster youth are exposed to sex work as a means of security after they age out. How can we bridge the gap so that youth do not end up in the penal system and then try to inform and reform behavior? And for Shari, one of the questions is, do foster youth, Rebecca, sorry, do foster youth have access to reproductive family planning through Family Pact? And if so, how can we increase accessibility? And can resource agents stockpile condoms, birth control samples to aid in bridging the gap? So those are our questions.
All right, well, this is Rebecca. Let me start with the contraception question and the family pack question. Foster youth in California have the right to access contraception and use contraception actually at any age, and can do so on their own and confidentially. State regulations have now been changed to clarify that young people, whether they're in a resource family home or in a congregate care facility, have the right to have contraception and use contraception if that's their choice. They can access that contraception through Medi-Cal or through the Family Pact program. Both of them are wonderful options to obtain contraception without having any kind of copay, and to get, for example, a 12-month supply if you're on, for let's say, a pill or something that requires a monthly subscription or prescription. And so I'm not sure if that's quite stockpiling, but that they do have the right to get a 12-month supply and keep that with them in their individual private storage space. Again, the California Department of Social Service website has some great resources, including a youth brochure that helps explain these rights, as well as where young people can go to access services and access free health care. One of the biggest questions, though, is how does someone get to a family pack provider or to a family planning clinic that they trust to get those services? And that's where those issues of transportation, timely access to appointments, and whose responsibility it is to facilitate and support that access are so important. And that's why the rule changes for caregivers and congregate care facilities like STRTPs and rules for caseworkers are important, because it helps clarify for those who want to provide support or transportation what they're allowed to do, what they're required to do. And again, the CDSS website has some really great resources that break this down and provide case examples and summaries of sort of the related law.
Great.
Oh, and I guess
thank you so much.
that there was also the question on trafficking. I want to note this is why access to education is so important. Issues of healthy relationships and consent and what trafficking is and what it looks like are part of the comprehensive sexual health education curriculum that the state has adopted. And if we can ensure that young people have access to education and feel empowered to make choices and decisions about what's happening with their body in a fully informed way, and we start that when they're young, that can really make a difference in terms of the kinds of choices people make moving forward. When someone's under 18 in California, engaging in any kind of exchange of sex for something, money or something else, they cannot be charged with a crime, but it is quite true that once they turn 18 or older, they could, and it's really important that people understand that difference and understand the choices that are available to them and are making choices in an informed way. And the best way to make choices in an informed way is to have trusted, accurate information and folks that you can talk to in an open and honest way, and that you feel safe having conversations with, so that you can enter adulthood fully informed and understanding sort of what your options in life are.
Great. Thank you so much, Rebecca. That was actually our final question that was submitted on the questions panel. And thank you again to all of our speakers today and all of our attendees today for your care of our young people in foster care, in probation, out-of-home placements, and for making sure that they have healthier futures. So please, again, join our coalition link, download our handouts, and we'll be looking forward to working with some of you on passing this legislation this year. Have a great rest of the day.